So earlier on, you had mentioned immune system dysregulation. Can you explain that and how you're going to go about treating it?
Sure. So immune system dysregulation is commonly known as autoimmunity. And many people don't really know what autoimmunity is, but they may know what the conditions are. So things like Hashimoto's is an autoimmune condition of the thyroid, or multiple sclerosis is an autoimmune condition of the brain. Well, why would your immune system attack your own organs? That's really the question. And much of the research is focused on the gastrointestinal system. And when you have long-standing gastrointestinal distress, or you're exposed to multiple antibiotics or other medications, or when you are exposed to different chemicals that may be added to food, you have a breakdown of the gastrointestinal lining. And we have very, very tight junctions within the cells, between the cells in the gastrointestinal system. And when these cells and these gap junctions start to widen, food particles end up getting through and into your bloodstream. And it's commonly called leaky gut syndrome. But much of the research says that these issues with the gastrointestinal system are the first and early signs of changes within the immune system. Because if a food particle kind of makes its way into your bloodstream, your immune system looks at it and says, that's a foreign particle, we have to attack that. So your immune system gets all ramped up and starts attacking that type of food. And because most of us eat the same thing every day or close to it, we have a chronic immune system activation where now your immune system is attacking food that you're eating on a regular basis. After a long period of time, the immune system becomes so desensitized to what it's supposed to be doing because it's attacking food all the time that it starts to look around for other things to attack. And that's when it begins to attack your organs. So it might attack your thyroid, and we might call that Hashimoto's thyroiditis. Or it might attack your brain, and we would label that multiple sclerosis. So what Dr. Imam and I always do is we look for causes, and we always scour the gastrointestinal system, and we look at nutrition, and we look at diet, and we look at different markers that can tell us about intestinal permeability. And if we're able to address those things, very commonly we see antibody markers come down. And we've seen things, even patients with myasthenia gravis have significant, unbelievable results based on the different types of functional medicine and functional neurology approaches that we take.